Sometimes, potty training hits a few bumps along the way. Let me arm you with tips to deal with the most common potty training issues. Resistance to using the potty is not unusual. You can reduce this by starting training at the right time. Make sure your child shows an interest before you begin potty training, and if there's been any significant life changes, such as a new sibling or a move to a new house, don't begin until things have stabilized. If you've already begun training, your child may temporarily regress during the transition, but will eventually return to his or her previous level of control. Resistance may also be a way for your child to get extra attention, to feel more in control, or ironically, to assert his independence. You may have inadvertently sparked this resistance if you've reminded or forced your toddler to use the potty a bit too much. Fear may be another reason for your child's refusal to be toilet trained. He may be fearful of change, of falling into the toilet, or of the sound of flushing. You should reassure him that nothing bad will happen and that he will not disappear down the drain. You can sit on the toilet yourself to demonstrate that you're safe and happy. Accidents are another common issue. Don't blame or scold your toddler if he can't control himself. Making him sit on the seat longer won't help. In fact, doing so for more than 5 to 7 minutes may cause negative associations with the bathroom. Instead, comfort him and make as little fuss about the incident as possible. If accidents do persist, you may explain that it's his responsibility to know when to go. At worst, he'll have to learn by experiencing the consequences of holding it in. Bedwetting is normal during toilet training. It takes longer to night train as your child is less aware while sleeping. Avoid excess fluid intake in the evening, and remember that the problem will likely resolve itself by the age of 6. If you've been trying in vain for a few months or more, or if your child is 3 years or older and isn't potty trained, ask your doctor for advice.